It's fair to me.
Yes, he did.
Well, if you don't know what fair is, you can't make it
Donnybrook is made possible by the members of the 9 Network.
Hey, thanks for joining us for another edition of Donnybrook. Hope you had a great 4th of July. We have a lot of hot topics on this hot Thursday, and we're going to meet the panelists who will discuss them and hash them out for everybody's amusement and entertainment. Starting with Wendy Wiese. She's the news director of the Big 550 KTRS. Columnist with the St. Louis Post-Dispatch, Bill McClellan. Radio host at KTRS and the founder and columnist with the Riverfront Times, Mr. Ray Hartmann. And, okay, let's see that T-shirt, or Alvin Reid from the St. Louis American. Oh, heavens to Betsy. Of course, you also hear him on 590 and 97.1 FM, the Dave Glover Show. And Ray, now Ray's bringing up, is that a Mizzou mug, Ray? And what do you have, Wendy? Is that
Missouri,
Fun Bun?
of course. I'm outnumbered.
Man, I got to get a Boston College mug or something.
All right.
Well, we're going to start with you
Mug
from the
week is
University of
next week.
Illinois Champaign-Urbana, Bill McClellan, who joins us, and we're so proud about that. There's a poll in Missouri from Garin, Hart, and Yang, Bill, and it has Joe Biden leading Donald Trump, and it also has Governor Parson leading Nicole Galloway. Do you buy it that it's possible that Donald Trump is behind Joe Biden 4 months away from November 3rd?
No, no. I saw that, and I wish it were true, but I don't think there's any chance in the world. I remember talking to a fella outstate Missouri, a thoughtful man, and he said we were talking about the big divide between the red outstate and blue. And he said, it's more complicated than people like you think. It's not just abortion. It's complicated. And it's a big cultural thing, I think. And right now, the cultural war that's going on, I think rural Missouri is on Donald Trump's side on that. Tearing down statues, marching against the police. I don't think that Biden's making any inroads at all.
I disagree with Bill. And let's be clear, polls are not predictive of the future. They are not as far off as people like to think they are as a snapshot of the present day. Even in 16, they were only off a point or two at most. But having said that, in particular with regard to Parson, Governor Mike Parson, I think he's got a real problem. He's only up 7 in this poll. And that may sound like a lot, having worked for a Republican governor that was up a bunch more than that this time and lost. Admittedly, Parson doesn't have me working for him, but he's still got a real problem. You look around.
Ray, just to stop you for a minute, if you really believe that Parson is only up 7, then you believe the rest of the poll? You think that?
I think right now it's very possible. It's very consistent all over the country. Trump and Biden are within the margin of error in Texas in a lot of polling. And a lot of them are really good polls, like Fox's A-, in their ratings and stuff. These are good. These aren't bad polls. And
well, you think about it. These are unprecedented
too early to say what's going to happen in November.
We haven't been through a pandemic like this before, and of course, we haven't seen protests in 140 American cities. Right. Everything's cattywampus. I think you can throw all bets out.
I agree. What I'm trying to say is almost every governor in the country has had a huge spike in popularity, and because of being in the news all the time on COVID. And Mike Parson should be way further up than he is objectively against Nicole Galloway, because he's been in the news and it hasn't benefited him. I think if I was working for him, and I think Nicole Galloway is a very disciplined candidate who has a real chance to win. I'm just saying it.
I kind of agree with both of you. I will say this, that let's go back 4 years and in a state that was just overwhelmingly, for Donald Trump and most of the Republican candidates that ran statewide, Roy Blunt actually kind of found himself in a race and he won. but he didn't win anywhere near the margin that the president did, which means some people who voted for Donald Trump didn't vote for Roy Blunt. So I can't put my finger on either side and say, like, I believe this is right or I believe this is wrong. Do I believe Biden will win the state? Absolutely not. So I guess I agree more with.
I say
Bill,
anything can happen. Wendy?
Charlie's, you're right about the pandemic and the fact that we've never seen how that translates at the polls, but to still have a president of the United States responsible for so much, if not most, of the mixed messages that we're receiving at a time when we're spiking, and that, Dr. Fauci, President Trump is at odds with Dr. Fauci at this point. That is unprecedented, to see a president of the United States disregarding the scientific community while numbers are spiking, hospital beds are filling up. And I don't think we know how that's going to translate. But if I were to put a bet down, I would say that it's not going to go well for the president as far as his handling of the pandemic.
And if I might jump in here to mention that Alex Garza, the chief medical officer at SSM Health and the head of the St. Louis Metropolitan Pandemic Task Force, is going to join us for the second half of this program. And I know you'll want to be here for that. Okay, our second topic, let's go to Alvin Reid on this one. We talked last week about Michael Neidorff, the CEO of Centene, who said that he's going to invest $1 billion in Charlotte, North Carolina. And if things like crime and Metrolink and masks and expanding Medicaid don't improve in this region, Charlotte would be a fine alternative for a corporate headquarters. Well, since we talked about that, Alvin, Jacob Barker from STLtoday.com reported that for the first time perhaps ever, because I've never seen this, maybe you have, a major Fortune 500 company has pulled out of the organization of leading corporations here, Civic Progress, and the company that bolted was Centene, no longer a member of Civic Progress. How about them apples?
Well, with all he had to say, I guess now it'd be about 10 days ago, I think this is kind of like putting your money where your mouth is. And he's got a fortune. And he's letting the St. Louis region know, and Civic Progress, that Civic Progress drags its feet. And that some of these things could get done if Civic Progress just said, we're going to do it. We're going to get it done. So, it was more than a shot across their bow. He actually, quit the organization. And I commend him for it, because he's had so much to say. And in a bizarro kind of way, he sounds like Stan Kroenke right before he bolted town, because he ran the city down and the area down. But he did it in a way that, was insulting. And I don't think Michael Neidorff did that. I think he told the truth. And I think he told the world that the CEOs know all these truths, but they're not doing enough to get it done. So I commend him.
Well, it certainly was. I don't know about Stan Kroenke. I was more reminded of Ed Whitaker when he took Southwestern Bell out of town. And he did it, for reasons that he didn't feel included in the movers and shakers. Supposedly he couldn't get into St. Louis Country Club. And Centene, there was a little bit of that spirit in him, I thought, when he talked about how everybody wants to know where you go to high school. Wendy brought that up last week. And it just seemed like a, petty little thing to say, like he's unhappy.
Well, Gussie Busch wasn't good enough for St. Louis Country Club. Apparently, that's why he built Sunset Hills. So if Gussie Busch can suck it up and just build his own golf course, if he's saying, okay, you don't want me, then I'll go take my marbles somewhere else and make my own fun, then I would hope that this generation's CEOs would be able to do the same. Apparently they can't. What I'm hoping isn't happening here is that it's not, as Alvin said, a shot across the bow. I'm hoping that it's not, he's got bubble wrap in his office and he's already wrapping stuff up. I hope that's not what's going on here.
Well, and I think, to Alvin's point, one of the interesting things I think about this is it shows how little the rest of us knows what's really going on in civic progress circles. I mean, it appears the civic progress is not as much of an activist in running things as it was in another century. But to Alvin's point, they had all these rules about who you could be in civic progress. The one guy they waived him for was Kroenke. They put Kroenke in civic progress, and he either showed up at no meetings or one meeting. I never could confirm that. He just basically blew them off after they made an exception for him when in 98 or whatever it was, or 95. But anyway, I think that this is a significant thing, and I wish we knew more about it because something's going on. And we just gave the guy taxpayers just gave him $175 million to help expand we talked about that last week, his headquarters in Clayton. This is I think there's more to come on this story.
Yeah, maybe so. I think they might have made an exception for Robert Hyland on civic progress back in the day, Wendy. But also, it does seem unusual because one of Nydorf's lieutenants is Tom Irwin, who, of course, used to be the head of civic progress, at least like their executive director, right? Well, Wendy, we didn't have a real good week when it came to crime. Last night, we had a shooting in City Garden, the beautiful garden on Market Street in downtown St. Louis. Michael Nydorf had offered facial recognition technology for Metrolink. We found out last Thursday there was an assault there, and the guards stood by and they did nothing. A state senator, Paul Whelan, says he wants to issue a travel advisory telling people don't go to St. Louis. That's really unusual. And we had too many shootings and too many young people shot over the weekend in the city. Do you think that we need another curfew, the likes of which we had after 4 police officers were shot and Captain Dave Dorn died in the city of St. Louis just about a month ago?
It sounds severe, but I think you're right, Charlie. I think we absolutely do. And I think that Mayor Krewson, when she enacted that curfew, she was doing it for the short term, and I think it lasted maybe 2 or 3 nights. I don't live in the city, so maybe it's easy for me to say they had a list of 5 or so reasons why you would be allowed to be out and about. But these are very drastic times, and I think they call for drastic measures. And Judge Jimmy Edwards, the public safety director today, he released a statement. I can't remember the last time he was so angry or frustrated about a situation where these 2 city employees were beaten by protesters outside of City Hall, hit with an assault rifle in the back of the head. One was punched in the back of the head. And he said that, they will be punished for their crimes. And I'm tired of situations being de-escalated. I think a lot of people want to see the laws enforced.
I'm tired of guys like Paul Whelan in Jefferson County, where I lived for 10 years, like Jefferson County a lot. But he has a lot of gall. I mean, is he going to disown the Blues and the Cardinals while he's disowning St. Louis with his travel advisory like we're some foreign country? I really don't think that. I hate that kind of stuff. And it doesn't help anybody. Maybe get him some political points in Jefferson County for whatever purpose he has. But I thought that was really, really ridiculous. We're all one community, and that includes Jefferson County. So I think he really needs to pipe down with it.
Yeah, that little whatever it was, he got his little 5 minutes of fame, and that's enough for him, because that's all he was looking for. As for the violence, do the police want a curfew? If the police want a curfew, then figure out what time it would be and what would you be actually stopping people for, and be transparent about it. I wouldn't have a problem with it. I will say this latest spate of violence, I'm not sure a curfew could have, would have, should have stopped yet. It seemed like it worked during the, when we were supposed to be in shelter because of COVID, which surprised me even. So I can't say it would work. I would say that, boy, like I said, this spate of violence was one that I just think would have happened, curfew or not.
I don't think a curfew would work, just because a curfew has more to do with parents than the kids. It's about taking these young kids home, and the idea is the parents are upset. And I just don't think that that's the case right now. I think a lot of the parents already know that their kids ought not be out at 2 o'clock in the morning or 1:30, 3 o'clock, and they don't know what to do. I mean, I don't think that
I agree with Bill on that.
Pushing it on the kids, but they don't know how to stop it.
And Ray, as far as Weiland, I agree with what you're saying in terms of the dog whistle and what he's trying to do and scoring political points. But what I kept going back to was the things that he pointed out are not incorrect. Everything that he was saying was actually, those were valid points about crime. I agree with, hear me. I agree with what you're saying about why he did it, but you can't dispute the fact that we've got a lot of problems now.
Of course we do, guys. But we also, hey, guess what? His district's got its own crime problems.
I understand. The
point is, I think we all own those too. Here's the thing. I'm not arguing your point. Of course we have a huge crime problem, but I would sort of with Bill, I think about, say, people in the city that maybe young people that are working at a fast food restaurant that have to go out, come back. I mean, I'm not opposed to them in principle. I just don't know that they would really work. And I think we got a lot of work to do. That's for sure.
I don't agree with Weiland, because I think I'd like to see people come into town, spend some money, help the businesses. And I think we all feel that way. But frankly, how is Weiland any different from our local branch of the NAACP, which still has a travel ban on the state of Missouri? So, I mean, it seems to me the crime has bridged the gap between the Republicans and the NAACP.
Good point.
Hey, let's move on to school. Ray, you always have very thoughtful insights to the issues of the day. And I'd like to ask you about school, because we understand the CDC has set some guidelines for schools across the country when they reopen in August or September, and they're scheduled to open a little later this year because of new state laws. So we've got that. But the question is, should kids be going back to school during the pandemic? Should they be on alternate days? And if they do go back to school, like at WashU, should the Bears at WashU be playing football this year? Ivy League has said no to that. Where do you stand?
Well, I didn't know I was thoughtful, but thank you. I normally try to keep my head down on it, particularly if it's college. I didn't go enough, so I don't really know that I should weigh in. I have a couple high schoolers who love school, who both have some misgivings for health reasons, and legitimate ones, are concerned about it. And I think too often we leave the kid, these kids are able to weigh in too. I will say this, I'm going to respect what the local education community says. And right now, without dragging it into national politics, there's great tension from the president. He's about to have the CDC rewrite its guidelines on education. I really think that it's going to have to be done trusting the teachers and the principals, the administrators, and the local school boards to make the decision that's best for them.
My daughter was giving me a big talk about this the other day. She works for Future America. And she said that there are some affluent suburban districts that could do the social distancing or every other day stuff, because, they have parents who one or two of them might be at home working remotely, and having the kids there is an inconvenience but possible. And she said in the city, it's Dr. Adams is under great pressure to get all those kids back in school, because in some of the kids don't have computers, or some that have computers might not have a quiet place. And the schools in poorer districts provide so much more than just education. There's services and meals and stability. And she said that Dr. Adams is under great pressure, to do this, where suburban school districts can be a little bit more, well, we'll do this or do that. So,
and I'm sure that was true when, all the online learning was going on, from March till the end of the school year. By the way, and I want to real quick, tip of the cap. I guess the Cardinals probably facilitated this, but the fact that the city schools are going to have one graduation, but it's going to be in Busch Stadium, whoever put that together, I give a big thumbs up to, because those kids do deserve to graduate. And hopefully, now I'm going to find out tomorrow that the Cardinals charged them $175,000 or something crazy. But no, I hope the Cardinals made that available to them, and I think that's going to be cool. I've got 2 college-age students, and they can't wait to get out of here. And I'm not booting them out, but, the freshman, or she'll be a sophomore at Missouri, and then my oldest will be a senior up at Dominican University of Chicago. And, they're ready to go back. They each have their own room, and they're ready. They're willing to give it a shot. So any school district that's willing to do it, then pray for them, and I stand with them, and hopefully to make it work. And real quick, Charlie, no, Washington University should not play football in the fall. No college should play football in the fall. Everyone should follow the Ivy League's example and say, like, hey, we'll see you January 1st. And we'll have football and baseball and basketball and hockey, all of them going on at the same time. It'll be wonderful.
This afternoon, the National Football League released some guidelines that were pretty thorough, actually. I think that the schools are a lot like the National Football League. They are forging ahead into the unknown, and they are not going to say that the year is canceled or the semester is canceled or the season is canceled until the season or the semester is canceled. I think they're just forging ahead because they feel like that's the right thing to do. And I think the schools are absolutely the same. There are so many transportation issues.
Oh, so many.
Go ahead.
Oh, I'm sorry,
Ray. No, I'm sorry. I was done.
Well, first of all, I had a question for the gentleman from KU. Are you suggesting with the schools should play basketball but not football?
Mr. No. I'm saying no. I'm saying everybody should shut it down till at least January 1st.
Okay, I agree with that. And I have to say, I think we need the kids to go back to school. The problem is, like all these other things, is we're going to have to follow the science. We're going to have to follow the facts. We just don't know what's going to happen. I think Bill's right. You can't have some one size fits all, but at the same time, kids really do need to get back to school, but we just don't know where we're going right now.
No, I agree with all.
Isn't it true?
That's why I'm looking forward to our conversation with Dr. Garza for that very reason.
I was going to say that. Maybe that'll be the first question when he joins us in just a matter of moments. Okay, well, speaking of sports, Ray, Adam Wainwright from the St. Louis Cardinals kind of gave a tough lecture to the fellow players that they have to be disciplined and maybe avoid the nightlife because it's all on the line. We're in a pandemic, and Major League Baseball has never walked down this road before. I think the remarks came almost the exact same day when some of the Blues players who had allegedly been at a Clayton bar tested positive for COVID-19. So it raises all sorts of questions. Do you believe that what Wainwright said rings true? Should players stay out of bars? Do you think that players who go to bars should be chastised by the other players?
First of all, Adam Wainwright's one of the great Cardinals of all time. Thanks for the 2006 World Series. It's a nice message. I think it's a message that I can't imagine he would be somebody out in the bars based on what we know about him. And it's fine. It's a fine message. I don't think it has any significant impact on what people's behavior will be. I mean, the young, particularly the single guys, but even others that are professional athletes do what professional athletes do. And I don't think there'll be any real meaningful impact from those words. I don't object to them.
I think that's kind of fascinating because we do now we're placing them on a pedestal where they don't have to abide by the same kinds of, Mike Schill told them the same thing that Adam Wainwright has told them. John Mozeliak said the same thing that Adam Wainwright has told them. If we all are in this together, and if we're all responsible for, crushing the curve, then the rules have to apply to all of us, whether we're baseball players or, somebody going to the grocery store.
I agree. And look, they've agreed to play. And for a prorated salary, a lot of them are still making a whole lot of money. But the whole thing is, all right, we're playing so people can watch us on TV, but we're also playing for whatever we're going to call a World Series championship this year. Guys, none of that stuff for 3 months. That's the challenge. And it's just too important to everyone involved to be frivolous. I would be a player that would be rating my teammates. And I'm party boy. They would say, oh, Clubhouse Alvin is suddenly like wants to, not go out at night. I'd say like, yeah, we can't do it right now. It's responsible behavior.
I got to tell you something. What Wainwright is telling them is exactly the Charlie Brennan lifestyle. You stay inside, you live a very boring life, and you kind of get used to it after a while. Hey,
it's easier to sell that though to an old guy than it is to some young guy in his 20s who, if he goes to bars, is going to meet glamorous women. That's a tougher sell.
I suppose.
And look, obviously the Cub players are all out in bars.
But the Cub players are more like what Alvin's talking about. They're
But folks, let's be real here. I mean, it's great for us. It has the same impact for us to say what we think as for Schilt or Wainwright, which is nothing. I mean, the same number of these young guys that go to bars in St. Louis, that go to the East Side at night, all of them is not going to change. I mean, we can say what we want. It's not going to change.
I disagree with you. I do disagree with you, Ray.
Really sad.
I just don't think it's going to change. I'm not saying it's good, bad, or indifferent. It's real. Is all.
No, I understand, but I do disagree with you. I think there will be a conscious effort to try to not get sick.
I hope so. I'm not arguing for it. I hope so. I don't go to bars anymore. I'm just saying that I hope you're right, but I just don't. I just a little bit maybe too cynical about.
I don't know, Ray. I think a lot of the blues players might be watching our program and taking careful notes listen to us. And acting accordingly.
To us.
I would hope so anyway. Okay, so what we're going to do is take a break here and then a short one and then come back with Alex Garza, who, among other things, is the Chief Medical Officer for SSM Health. But most recently, he has been the head of the St. Louis Metropolitan Pandemic Task Force. And he's the fellow who represents a collection of hospitals who are helping set COVID-19 policy for the entire region. So we have a lot of questions for him. I know you'll find this fascinating. So under no circumstances, touch that dial.
Donnybrook is made possible by the members of the 9 Network. Donnybrook is made possible by the members of the 9 Network.
Well, thanks for joining us for the second half. And this is where we talk to a community leader, put him or her on the hot seat, ask the tough questions, and get the answers that people are looking for. And I can't think of anyone more relevant to today's news than our next guest. He's Dr. Alex Garza, the Chief Medical Officer for SSM Health, but also the man who's heading up the St. Louis Metropolitan Pandemic Task Force. Dr. Garza, thank you so much for joining us on Donnybrook Part 2.
Yeah, sure. My pleasure.
I'm looking at some of the numbers, at least when it comes to coronavirus in the state, and the cases have really jumped up 2 major spikes this week alone. So that's not good. But then if you look at, let's say, the city of St. Louis under deaths, I think we may have had 4 in the last 2 weeks. And of course, that's 4 too many, but it seems like it's under control in the city. Am I right or wrong on that?
Well, I think you're partially right, but the true answer is going to remain to be seen. And so the reason why I say that is we have seen those spiking cases. If you look at the data underneath there, you look at the different age groups and the people that are becoming infected. And by and large, it's mostly the younger age groups that are becoming infected. And so that's making up a large number of those cases. And we know that those age groups they aren't as badly affected by the virus. So they don't require hospitalization, and it's a low risk for mortality as well. However, hospitalization and mortality data are lagging metrics. And so those metrics really show up later on down the road. So what the concern is then is we have this high volume of cases that are within the city, within the county, within the metropolitan area. Eventually, they're going to find susceptible hosts, and then that will cause an increase in hospitalizations, and it will cause an increase in death. We probably won't see it for a little while, but it just definitely increases that probability that that's going to happen.
Bill?
Yeah, doctor, schools are set to open again in maybe a month. And in some of the affluent school districts, there's talk of staggered schedules and a mix of online learning and classroom learning. But in poorer districts, and specifically the city, it's more difficult to have online learning. The kids, all of them don't have computers, access to Wi-Fi. The kids need the services that schools provide, including meals, breakfast and lunch. And it seems like, and the parents are less likely to be able to work remote. So having the kids at home isn't just an inconvenience, it makes going to work impossible. And it seems like Dr. Adams is under great pressure to get the kids back in school. And I'm wondering what specific steps you're doing to help it.
Yeah, no, that's a great question, Bill, and you've outlined it very well.
I got that from my daughter. She works for American.
Yeah, but you've outlined all of the challenges extremely well. And so, some of the things that we need to be doing, not even necessarily as a task force, but I think collectively as a community, is trying to reduce those barriers so kids can go back to school safely, but more importantly, effectively. So it is those things like access to broadband. So you probably saw the governor signing a bill the other day to improve access to broadband, which will improve educational opportunities. Now that probably isn't going to come in time to affect school. But if we can establish other mechanisms where we can get broadband into school through our local access companies, that would be a good thing. The social distancing and all of the other things that go along with it, I think, are a particular challenge just for what you outlined there. So if we're saying kids can come to school 3 days a week or 2 days a week, that leaves a couple of days where they're going to be unattended and they're not going to be able to receive those services that you said. And it's not just food. Kids also receive, special services for other things, whether that's occupational therapy or other sorts of things. So then you're left with a capacity problem. So how then can I allow, or how can I get more kids into a building where they can get the services? And that's where you really have to, try and figure out what is the best way to do that. So one of the things that I have heard of people attempting to do as well is some of the upper grades that may perform better on remote learning, things like that. Maybe we shouldn't be having, the junior and senior year coming in, so you can bring more younger kids into a classroom. And I know those discussions are going on right now, but it is you're absolutely right. It's an incredibly complex issue. I don't think most people appreciate what an ecosystem the school system is. And if you take that out of people's lives, it creates second and third order effects. So we do have to specifically address those barriers. Now, how we go about doing it, how we can become creative in order to mitigate some of those barriers is really dependent upon the working with the school district together with public health. You got to minimize risk, balance that with getting the kids back in school, trying to eliminate all of those barriers that you said. Unfortunately, it takes much more than just the task force can do to try and eliminate some of those barriers. But you've done well in articulating them for sure.
Dr. Garza, thank you for all you're doing. I don't have nearly as good a question as Bill, probably, but a lot of us are kind of puzzled trying to follow the numbers. I think I saw you on TV one day that there was a spike saying, well, it was due to a couple days of no reporting, which is a little unsettling, really, because first of all, do we have a reporting issue in our region? And what are the numbers telling us? It feels like we're not necessarily having a second wave as much as maybe the first wave never ended, but where are we headed in St. Louis in particular, do you think, with the numbers?
Yeah, no, I hear what you're saying, and yes, there's not just a reporting issue here in the St. Louis metropolitan area. It's really across the country, and so you've noticed that in other areas as well when you're looking at their numbers that they can fluctuate quite widely sometimes, and that's due to some of those national labs that have those large contracts with state governments and city governments and things like that. If they're not able to provide timely data, then they'll batch it and they'll send it all at once. And so I really think it lays bare some of the internal sort of infrastructure with public health that's in sore need of upgrading and building into a solid process. And you're right, it does make it challenging then to understand where are we with the pandemic in time and space. It makes it extremely challenging. And then it makes it even more challenging to say, what sort of policy decisions do I need to be making because of the data that I'm seeing? And when it's delayed by 10 days or they do large data dumps, it makes it even that much more challenging. So one of the ways that we do try and smooth that data out is through those rolling averages. So even if you do have those wild fluctuations, if you can average it out over a period of time, it smooths that out a little bit. And so that is one way that we look at it. But in answer to your question about where we are, we're definitely on the increase. And I don't think that's a surprise to anybody. The curves are going in the wrong direction. I was speaking with some of the health department leadership, and they're concerned about the numbers that they're seeing too. And it's getting to that point where they're seeing the largest numbers that they've seen since the pandemic started. And so I'll reflect this then back on the hospitalization numbers as well, because we haven't seen a dramatic rise in hospitalizations, which is good. But I'm always fearful about what is behind sort of that crest of patients that's coming. And will we one day then see that floodgate open up and all these patients show up? So that's the concerning part. Definitely a reporting problem. We are on the upswing. Whatever we can do to tamp it down is a good thing.
Dr. Garza, okay, take me through kind of how the tracing is working, in that if I, we're tested and I get a call and said, like, you tested positive, and I don't have any symptoms. From that point where I know that to quarantine myself and I would get that. But am I asked where I have been? Am I asked to do that online? Because wherever I got tested at, I'm not there anymore, obviously. So I can't fill out a form right there on the spot. What happens once I find out? I mean, I know I'm taking care of myself and my family, but as far as where I've been and who I was with and all that, how do you find that out?
Yeah. So I'll walk you through the process, and public health does that, and so I'm just reacting off of our discussions with them. So you feeling ill, or you just go and get tested just because you want to know if you have COVID or not? You do have to write down your demographic information, so where you live, zip code, things like that. Your test gets sent to the lab. The lab does the test. You turn positive. The lab then either reports it back to your care provider or to the county health department, and sometimes both. But the county is where that data, or in St. Louis City and to the city, the health department is where that data goes to. And now, so that's another issue with reporting times. So if you're delayed in reporting times and somebody is walking around without knowing their test results and not knowing if they're continuing to spread. So once that happens, though, so once the health department knows who you are, then they start reaching out and trying to contact you. So they'll go through different means, whether it's through mail, phone calls, whatever, trying to find out who you are, get in contact with you. And then they start asking you a series of questions. So this is all person oriented. So somebody is physically on the phone calling you saying, hey, Alvin, where have you been for the last week? Tell me where you've been, who you've interacted with, and then they'll want to know how much time did you spend with that person? How close were you to that person? And in the back of their mind, they're doing a calculation on, is this a person I need to be worried about that could have potentially acquired the virus from being around Alvin? And if you say, hey, I was with my brother and his wife, and we were sitting in a really small room and we were singing music and we're arguing with each other, meaning, a lot of volume and things like that. Then they say, well, we think that's a potential exposure. Please give me your brother and your sister-in-law's name and number, and I'm going to go call them. And by the way, now you're quarantined for 14 days, right? Then they will take that next step and call your brother and sister-in-law and say, we understand that you were hanging around with Alvin, 5 days ago. He's tested positive for COVID. But we need you to either isolate yourself for a period of time or go and get tested to make sure that you're not positive. They'll want to time it out in a specific time, because you don't turn positive like the day after you were exposed. It's a number of days. And so they'll say, in this number of days, we need you to go back and get tested, or you can just isolate for any number of times, any number of days. And so that's typically how it works. And then they just work their list. So they get a list of names every day. And that's what they do, is they just go through, find the people, find their contacts. So the interesting story with this is during the shutdown, when they were discovering cases, the number of contacts was around two people, right? Because they're sheltered in place. They don't have any place to go. They're not around anybody. Now it's getting closer to like 5, 6, and you can imagine then the workload is doubled when you start doubling the number of people you need to find and trying to reach out to them and get them tested and make sure everybody's isolating or in quarantine. And so it's a rolling boulder. It gathers more debris as it goes along if you've got more contacts.
Thank you.
Yeah, sure, anytime.
Dr. Garza, we know that really for all practical purposes at this moment, that social distancing and wearing a face mask, which are, the masks are now mandatory in St. Louis City and County. Difficult to enforce, but mandatory. Those are the vaccines that we know in this moment that work. Are there places in the country that are comparable in size and population density to St. Louis that are doing it correctly? I mean, do you have those conversations with other health professionals and health department officials across the country?
Yeah, so I would just maybe push back on you a little bit, Wendy, when saying it's not really a vaccine, because a vaccine is sort of the cure, right?
No, but I'm just saying that's the only medicine that we have right now.
It's the only mitigating sort of tools that we have right now, right? And so there are other areas of the country that have had mask orders in place prior to St. Louis doing that. And so when we look at our epi curves for St. Louis, the metropolitan area, and then we compare them to, so I just did this the other day when I was looking at some of the other regions, and a couple of those other regions, I believe it was Pittsburgh, I'd have to go back and double check that, had a very low epi curve throughout the entire pandemic. And as I went to their website, and I think Pennsylvania had a mask order in place across the entire state. Plus, there are a number of scientific studies out that have showed that counties and areas that have implemented mandatory mask policies have a much different rate of cases than counties that don't, and they can match it up to the time where the policy was implemented. And then the third piece I would say is globally, when you look at countries that have dealt with the pandemic, there's a clear distinction between countries where mask wearing is culturally accepted. And so if you think about countries such as in Hong Kong or Taiwan or Korea or places like this, where it's much more culturally acceptable, they do it routinely. Their rate of cases was much lower than the United States. Now, there's a number of other reasons why that could be, but if you take it on its face value, there is a lot of evidence that supports that this is one way to suppress transmission in the community, and it's a relatively inexpensive and easy thing to do. The biggest challenge that we have is, just as I've mentioned, is it's not something that's as culturally acceptable in the United States. And unfortunately, it's become almost a political, well, I shouldn't say almost, it has become a political issue here in the US. And that's really unfortunate because it really doesn't have to be that way. And to me, this is just another form of protecting yourself, protecting your family, protecting your community. But in answer to your question, yes, there are other areas across the US that have implemented this and have done it well and have kept those transmission rates low.
But what's the consensus among healthcare experts when it comes to the protests? Because we do see a lack of social distancing. We do see some shouting and chanting. And we are told that, yeah, a mask is really effective, but the benefits of a mask can be offset by singing and shouting. And so it seems as though we've kind of turned a blind eye, maybe not only to congregating in bars or at places where people gather inside, but outside, we have protesters who are clearly doing things which would not be helpful during the pandemic.
Yeah, Charlie, you're right in that anytime that you increase the number of people that are in a confined space, or it's outdoors usually, so it's not really super confined, but still in a smaller space. And if people are talking loudly, yelling, singing, things like that, there's a lot of data that says then you're expelling, more aerosol, more virus, and so that does increase the probability of transmission. And Charlie, I do think that you are right as well, and that there was a piece about this in the New York Times about public health officials can sometimes be rather discordant in what they're saying when it comes to either the social unrest and the protests versus what's right for the pandemic. And so we've been trying to be very clear that when we're talking about the pandemic, anything that we can do to decrease transmission in the community is a good thing. Now, whether I agree or disagree with the protesters, to me is not as germane as what are we doing to decrease that transmission. And so any sort of large gathering, doesn't matter if it's protesters, doesn't matter if it's in a bar, doesn't matter if it's at a baseball game, is going to increase your risk. And we have to do everything that we can to mitigate that risk. But I do agree with you, Charlie. There are some mixed signals that come out from public health and from healthcare officials on that.
Bill?
Doctor, there was a story in the Post-Dispatch this morning about KinderCare, a daycare center on Hampton Avenue that was temporarily shut down because a person had tested positive. And there was like 10 teachers, the story said, and 50 kids, something like that. And the company would not tell the Post-Dispatch reporter whether the person who tested infected was one of the kids or one of the adults. And I thought, it would be nice to know that, because we're talking about opening schools, and it would be helpful to know if children are coming down with this. And yet there's the privacy issue. People say, the press will figure out who it is if you say a 4-year-old girl. And where do you come down on this privacy versus public right to know?
Yeah. So I apologize, Bill. I didn't read that story this morning. But There are a certain set of federal rules that I'm sure most of you are aware of, the HIPAA rules that healthcare has to follow, and that is divulging enough information where it's personally protected. And so I'm assuming that the person that the reporter was talking to felt that if they gave out that level of information, that it would be
Well, that's a
potentially
pretty
somebody could
basic
figure it
level,
out.
don't you think, Doctor?
Yeah. You know, that is a pretty basic level. You know, and sometimes it gets down to how comfortable is somebody with releasing some information. So it's hard for me to say what the particular, you know, motivation or whether it would have been acceptable or not for this person to release that sort of information. But to your question about what is important for public health to know, so clearly public health, you know, within their role of dealing with disease in the community, does have a right to know that information. It's how much further spread is the right to know about that type of information. Now I will tell you, just in hearing your story, that it is probably more likely that an adult brought it in than a child brought it in. There's some good evidence that shows that kids, it's a little bit more challenging to transmit amongst kids than it is amongst adults. And a lot of the studies looking at households where a positive COVID patient was, when they go in and test all the family members, the kids will test negative at a higher rate than the adults. So that leads you to believe that it's more than likely one of the adults. But in terms of the privacy issue, you know, you're battling up against that federal regulation, and we all take it seriously. You know, because it's the right thing to do. But we can also, you know, have some pretty stiff penalties if we're found to violate it, and I think that sort of perpetuates a lot of that as well.
Right.
Dr. Garza, I know you want to stay out of politics, but Donnybrook, can you, not all state health departments are created equal, and some states have mask orders and some like Missouri don't.
Mhm.
Does it concern you? Obviously you prefer that the city and county do. How much does it concern you that Missouri doesn't have a mask order as a health professional? And how would you characterize the task force, you know, working relationship with the state health department?
Yeah, good question. So, you know, I'll just go back to what can we do to decrease morbidity and mortality from the pandemic. And clearly, one of the things that we could do, which I've said earlier, is relatively easy, simple, inexpensive, is to wear masks. So, from a public health perspective, from a healthcare perspective, yes, I would prefer it if we had a mask wearing policy across the state. Some people will make the argument, well, it's different in the rural areas than it is in the urban areas, but that's not necessarily true when you're looking at the numbers and how they're growing in the rural areas just as quickly as they are in some of the metropolitan areas. And so I don't believe that is a valid argument. But as you rightly pointed out, Ray, it's a political issue. So there's a lot of you know, deep held beliefs on whether somebody can tell me what to do or what not to do. But we've done a number of these things from a public health perspective throughout time. So whether that is wearing a seatbelt or you know, as a healthcare professional, I have to have vaccines in order to go to work. And it's not just to protect me, but it's to protect my patients as well. And so we do a number of things in public health, not to just you know, impose the will of the state on the person, but it's for the better good of the society. And I would put this in the same bucket. As far as our relationship with the elected officials, so as you know, we work with the metropolitan elected officials, and we do have members of the task force that interface with the governor's office. I have personally worked with segments of the governor's office, and so we feel like we have good representation there, and that our voice is heard. You may know that the modeling group from Washington University also does the data for the state. And so we feel like we have a pretty good relationship across those offices and with the task force as well.
Dr. Garza, I'm afraid we're out of time, and that is all we have for you this week. But with this goodbye, we'd like to invite you back for another segment, if your time and interest permit, hopefully sooner than later.
Sure. Anytime, Charlie.
Thank you so much. Great questions tonight, and we really appreciate your answers. Dr. Alex Garza, of course, the Chief Medical Officer at SSM, and the man who's been heading up the St. Louis Metropolitan Pandemic Task Force. Ladies and gentlemen, thank you so much for joining us. We'll see you next week at this time on Donnybrook.
Donnybrook is made possible by the members of the 9 Network.